Welcome to our virtual fireside chat today, addressing mental health to become a veterinarian. I'm Dr. Tony Rumschlag, Senior Director for our U.S. Pet Health Consulting Veterinarians at Elanco, and I'm excited to be joined by my colleague, Dr. Heidi Hulon, a consulting veterinarian for Elanco. Heidi's created a veterinary series that focuses on veterinarian development and mental health. Veterinary professionals are viewed as pillars of our communities and trusted advisors to keep pets healthy. However, the profession's really seen a rise in mental health challenges, especially during this last year, as veterinarians have navigated the pandemic response and the recovery. Well, today we'll discuss the mental health challenges in the veterinary field and how the Betterinary series can help address this issue. So, thanks for joining us, Heidi. I'm looking forward to this discussion.
Good morning. And I'm looking forward to this. I'm very passionate about this, both on a professional, but also on a personal level. So I'm excited to start engaging in this conversation.
Well, I'm glad because it's something I know is deep and passionate to you. So, first question I have is, when you look at veterinarians, why do veterinarians face more mental health challenges than perhaps other types of professionals?
That's the question, right? And if only we could solve that. But really, it's the question that plagues our profession. And as you pointed out, COVID has only made things worse. And they were pretty bad before. In fact, in 2014, it was found that 1 out of 11 veterinarians had severe psychological distress, and 1 out of 6 had had suicidal ideation since graduation. I mean, why? People view us as so lucky to be in the veterinary profession. Of course, they think we play with puppies and kittens all day, which we don't. Uh, but it really is something we struggle with, and it's not something that we're honest with in our profession. We're not always realistic, especially for those that are entering into the profession. That, hey, this could be a potential issue. Do you already have risk factors, and you might need to look for some assistance getting through this. Now, in my mind, there are multiple reasons for this. One, it's thought that people who have had previous trauma in their own lives seek out professions that allow them to help others, to maybe prevent others from suffering and going through what they did. And that's very much true for veterinary medicine. We want to help animals, to alleviate suffering in those that cannot help themselves. The flip side of that, unfortunately, is by doing so, we enter a profession where we see and we hear traumatic things every day, both in patients, but also in clients. And we really we bring them on as our own, and we hold on to them, and we suffer the consequences. Compounding that is also there's a lack of training in regards to these issues, both as someone who might have mental health or emotional issues, and then training to be someone who can provide help and just simply to recognize it. There is this sadly silent stigma against asking for help. So we kind of just hold on to it and say, you know what, I'll figure it out as I go along. And it ends up being, a difficult thing. And a lot of people do not come out of it in a good way. So, in my opinion, and following this, is one of the biggest factors is that we do not practice self care. And we just
Right.
said, doctor, heal thyself. We don't do that in veterinary medicine. And I've been tracking this through insights training. And what I find is that as a profession, we are loaded with earth green, caring, compassionate, empathetic people who therefore get empathetically exhausted every day very easily. And when our emotional well being is poor, and this is true of everybody, especially since COVID, this has affected almost all of us. When your emotional well being is poor, that translates into poor social, mental, and physical well being.
Well, you mentioned COVID. So, how has COVID really impacted the mental health of veterinarians?
Yeah. several ways. So again, it was bad before, and then throw in COVID, and it just, magnified the situation. So a couple different ways to look at COVID, and there were some difficult ways to look at it, and I'm going to always try to be the optimist and end with a positive note. But when COVID first hit and clinics could not be open or were very limited in what they could do, that created a lot of fear. One, about the business. Will my business survive? Will I be able to, take care of my employees and myself? But I really feel that one of the biggest contributors to the issues that um, were hurting them during COVID was they were not able to live up to their purpose of helping their patients. Meaning and purpose are major factors in well-being. These are the driving forces as to why we actually got into veterinary medicine. When we can't work towards them, we lose a sense of who we are and what we are here to do. And I think that was a huge issue for veterinarians is I'm not doing what I was meant to do. I cannot help those who rely upon me to care about them. As things got going and they were able to see, their patients, what they realized was that I have more patients than I know what to deal with. I only have the same number of hours, the same number of exam rooms. The resources didn't change. And in fact, in some cases may have gone down because they've lost staff members. Clients were misdirecting negative emotions at them like never before. And they're having to figure out, the business aspects of veterinary medicine. The medicine stayed the same. And the biggest or the hardest element was, and this is our little known secret, is we are a people profession. And the people became the difficult part of that, again, because we don't get a lot of training. So this is stressing out, the teams, they lose employees, they hire new employees. And there are employees now in veterinary hospitals that have never been in an exam room with a client. And they're like, wow, whole new game. What do I do? And as a profession, again, we suffer from perfectionism, lack of boundaries, and a lack of self-care. All of that just elevated the stress, the burnout, and again, the empathetic exhaustion that was always there. But as I said, here's where I'm going to be optimistic. Here's where one good thing came out of this. They asked for help. They finally realized we cannot do this alone. This is not the way we want to practice. We want to have more satisfaction and fulfillment. Help. Please help us.
That's great. Well, I know you created the Betterinary series, so tell me more about that. What is the Betterinary series?
Well, I like to think it's just what the doctor ordered. Help. But yeah, the Betterinary series was in response to what I had been seeing, what I'd heard, and I'll be honest, what I had experienced when I was in practice. And it's just this overwhelming sense of, "Oh, what is this? What really am I expected to do? I was trained very much, in as we all were, how to do the technical part of the job. We were not trained on how to handle what the job does to me, what the job might do to my staff. Therefore, the Betterinary series was created to help with the vision of making the profession healthier, one veterinarian, one technician, one office manager, one team member at a time. And it's a series of talks, interrelated. You can do them separately, you can do them together. They build upon each other, that are focused on promoting skills that are necessary for well-being and satisfaction in this profession. And right now, there are 10. They are race approved for CE, and I currently am working on creating more.
That's excellent. And I know it's been very popular with the profession. But as a veterinarian who would like help, where can they go?
Yeah, and again, that's a great question. And the first thing to realize is that there are lots of places for them to go. Ask for help. Don't sit there and be ashamed, don't feel scared, don't feel alone. Okay, again, we need to get rid of that stigma and that feeling of isolation that, there's something wrong with me. That there's not. You are not alone in how you are feeling. So there are many resources for you, and it's about your comfort level. You could reach out to those within your support network, connections. Again, another very important foundation of well-being. And when we say support network, that could be family, friends, colleagues, clergy, coaches, whomever, just somebody to listen. Or you can reach out to professionals. And our profession, veterinary profession, we're slowly developing our own resources. But right now, you're probably going to have to look for the majority outside for more mental health specific resources. But it is okay to ask somebody. Specific resources, AVMA. AVMA has a wellness group. Lots of resources online that you can reach out to, and that provides anonymity. If you don't want anyone to know that you're going through this, you can keep your privacy. Most state VMAs have a wellness program. I was just elected to my state's veterinary wellness program. There are groups such as Not One More Vet. If you're a technician, there's NAFTA. Some of the colleges, if you're a student or students, they have their own resources to support the students as they're going through veterinary school and these issues start to arise. You can reach out to colleagues. There are colleagues out there that are trained. For example, I have a QPR suicide training, and I'm a mental health first aider. There's the National Suicide Hotline. There's the Crisis Hotline or the Lifeline Crisis Chat, both of which are specific to mental health help. The big thing is just to ask. Just reach out, ask for help, and if someone asks you for help, don't think you have to fix the problem. Most importantly, be there. Be there to listen, to show support, and to not judge.
That's great, Heidi. I wouldn't have realized there were so many different places you could go for help. And as I think about the people that veterinarians provide service to, is there a place for pet owners, farmers, or anyone who's interested in the cause support these types of efforts?
Yeah, and I love that you brought all those groups together because we're all interrelated. And anyone and everyone associated with the veterinary profession can support and make a difference. And the first step is awareness of understanding what the veterinary profession goes through. Very few people outside the profession understand that we have these mental health, these emotional issues, issues with suicide. And once that awareness is there, it changes in a good way how they view us. And again, that sympathy, that empathy, that concern for those that they respect is emboldened. And I love that. And it makes them want to be a part of this. And it's only when we all join together and support each other that we will be able to defeat what plagues our profession, and then we can truly prosper. To care for others, we must first, though, care for ourselves. And when we honor our own care, we are better able to fulfill our meaning and purpose of caring for others.
Well said. Well, Heidi, thank you so much for joining us today on this important topic. And thank you all for tuning into this conversation. If you want to learn more about Elanco's role in supporting veterinarians, visit www.elanco.com.